If you have high blood pressure and you'd like to know how to reduce it naturally, you clicked on the right video. And stay tuned till the end where I will give you my top tips for reducing your blood pressure naturally. So before we get into that, I just want to review what exactly is high blood pressure. And what is considered to be normal blood pressure is a reading of about 120 over about 80. And in order for it to be considered high blood pressure, also known as hypertension, it needs to be at least 140 over 90. And that has to occur 3 separate times on different occasions, not 3 times in a row. By the way, a lot of people don't know this, but if you keep taking your blood pressure over and over, especially on the same arm, and you're not giving it a break in between, you're not going to be getting accurate readings. So don't do that. So let's just review what those numbers mean very briefly. The top number, also known as systolic, is when your heart is contracting or squeezing the blood out. And the bottom number, known as diastolic, is when your heart is relaxing and refilling. So the problem comes in when your heart has to work too hard to squeeze it out and or to relax, and the pressure inside your blood vessels increases. So if you have high blood pressure, you probably know what the risks are, but I just want to mention them briefly. You are at higher risk for a stroke, which is going to cause, possibly cause damage in your brain, a heart attack, which obviously will cause damage to your heart, and also kidney disease. So high blood pressure is the second leading cause of kidney disease, first leading cause being diabetes. And we'll talk a little bit about diabetes in a few minutes, because diabetes and high blood pressure often, not always, but often go together. And high blood pressure can cause other organ damage as well. For example, it can damage your eyes. So when the pressure inside your blood vessels is too high, it's causing damage. And then the vessels leading to various organs will become damaged along with it. So let's talk about some of the most obvious causes of high blood pressure and things that you can change, things that you have some control over. So number one, smoking constricts your blood vessels. When your blood vessels are constricted, when they're tighter, the pressure goes up. Okay, so I'm not trying to make it sound easy to quit smoking. I know it's highly addictive, but that's why smoking leads to a higher risk of stroke and heart attacks. Number two, heavy alcohol consumption. So alcohol actually stimulates a reaction in your nervous system that elevates your blood pressure. So if you're drinking a lot, let's say 3 or more drinks at a time, you are elevating your blood pressure. If you do that on a regular basis, it's going to stay elevated. Number 3, caffeine also elevates your blood pressure. So I'm not saying that you need to quit drinking coffee or tea, but if you do have high blood pressure, you have to be careful about the quantities of it that you're consuming. Caffeine also is a diuretic. When you become dehydrated, your blood pressure goes up. Why? Because blood is made out of mostly water. So when you don't have enough water, you don't have enough blood, and then the heart has to work harder to pump your blood throughout your body, and your pressure will go up. So if you are drinking a lot of caffeine, make sure you're also drinking a lot of good quality water, and we'll talk about that in a minute. And I just want to say here that very often people who are drinking a lot of coffee are drinking a lot of coffee because they have low energy, which is often caused by the adrenal glands That's your stress gland not functioning properly, and that's often due to stress. So stress causes low adrenal function, which causes you to want caffeine and or other stimulants like cigarettes or sugar, which in turn elevate your blood pressure. So the underlying issue there is stress management and helping to support your adrenal glands. And we'll talk about that in a minute. The next thing, number 4, is eating a heavily processed food diet. So processed foods are bad for you for so many reasons. They're loaded with chemicals and other toxins. And my whole channel is dedicated to why eating processed food is bad and why eating nutrient-dense food is critically important to your health. But in relation to high blood pressure, processed food is very high in sodium. So, and when we're talking about sodium, sodium is actually a mineral that your body needs. But in processed food, number one, it's what I call the bad kind of salt, made in a lab, sodium chloride. It's processed, right? It's not straight from the earth, and there's too much of it in there, right? So salt actually throws off your fluid and mineral balance. So when you're eating too much bad salt, your body will retain fluid. So the fluid ends up in your soft tissue rather than inside your blood vessels or in your cells where you need it. And then it also, too much sodium throws off your mineral balance, and the important minerals like potassium and magnesium are especially affected by eating a high bad sodium diet, right? And potassium and magnesium, we'll mention those later, actually help to lower your blood pressure. So too much sodium, not enough potassium and magnesium puts you at risk. And by the way, processed food does not normally contain potassium and magnesium. We will talk about what foods do contain it in just a couple of minutes. The other problem with a processed food diet is the sugar content. So a high sugar diet, first of all, depletes your minerals in your body the same way high sodium does. Sugar competes with minerals and other nutrients for uptake into your cells. And guess who wins? That's right, you guessed it, sugar. So when you get too much sugar into your cells, you're not getting enough minerals and other nutrients, right? That causes your insulin levels to go up, because when you eat sugar, your pancreas produces insulin. And when you do that on a regular basis, you become what's known as insulin resistant, which is the leading cause of type 2 diabetes. But insulin resistance also causes your blood vessels to become stiff. And when your blood vessels are not flexible or pliable, when they're too stiff, blood pressure goes up. So, most people don't think about the connection between diabetes and blood pressure, but there it is. That's one of the connections. The next thing I want to mention, which I alluded to earlier, is stress. So when you're under a lot of stress, you activate the fight or flight response in your body over and over again. And that just naturally increases your blood pressure. It's actually a normal reaction to an emergency, right? So if you're about to be run over by a car, or you're getting chased by a wild animal, which I'm sure is not happening to most people, but just as an example, you have a stress response, which includes your adrenal glands secreting hormones like adrenaline. And the end result of that is, one of the end results of that is that your blood pressure goes up. So when you're under chronic stress, you're stressed all the time, even when you're not really under stress, but you're feeling stressed, that can lead to chronically high blood pressure. Your body is producing hormones that keep it elevated. The next thing, number 6, is something called metabolic syndrome. So metabolic syndrome is a conglomerate of different symptoms in your body, such as high blood sugar or insulin resistance diabetes, obesity, especially belly fat, and it can also involve your pituitary gland, which is kind of the middle manager boss of your hormones, your hypothalamus, which is the higher boss. So your hypothalamus is in your brain, tells your pituitary gland, also in your brain, what hormones to secrete. The pituitary gland tells your thyroid what to do, your adrenals. So there's this whole conversation going on with all these different glands in your body. And hormones also have a lot to do with blood pressure. See, this is something people don't know. Your adrenal glands produce hormones that tell your blood pressure what to do. Your adrenal glands produce a hormone that tell your body what to do with salt and water. Your kidneys produce hormones that tell your blood pressure what to do. It's all interrelated. You can't separate it. So if you have metabolic syndrome, right, you're either borderline diabetic, or your blood sugar is on the high end of normal, or you're diabetic, you have insulin resistance, you have overweight, you have high blood pressure, high cholesterol, high triglycerides, any of those things, that needs to get addressed. Number one, with changing your diet. We'll talk about that in a minute a little more. But you might need specific individual help with it, which I have expertise in. If you want to reach out to me, if you're struggling with any of those things. And for women, you might have polycystic ovarian syndrome that goes along with that. And we'll do another whole video just on that topic, on the female hormone imbalances. If you're a man, you might have low testosterone and low energy. So it's a hard way to live your life. And I am seeing this more and more in younger and younger people. So if, like I said, if you do need help, my website, drcori.com, will be in the description. You can click on that, fill out a form, reach out, and we can do a virtual consult. I've helped thousands of people with metabolic syndrome. And then the last thing I want to mention as a risk factor for high blood pressure is sleep apnea. So sleep apnea is where you basically either stop breathing while you're sleeping, or you're not breathing properly, or snoring a lot. And this also can be part of metabolic syndrome. It gets worse if you're overweight, because you literally have fat that develops over here, putting pressure on all of your breathing apparatus, right? So losing weight is critically important for sleep apnea. And a lot of people with sleep apnea end up using a CPAP, which is a machine that forces air into your nose and into your lungs. But we try to help people not need the CPAP, because most people don't like it. It's not very comfortable. But changing your diet, losing some weight, and changing your sleeping position are some of the things that you can start with trying to do. So let's talk about what you can do naturally to help yourself with high blood pressure. Number one, of course, a nutrient-dense diet, okay? That's not full of junk, processed food, fast food. All of that is going to affect your health negatively one way or another. If it's not high blood pressure or high blood sugar, it'll just be toxins. So it's really important to clean up the diet and eat foods that are high in the minerals that help to lower blood pressure, which are potassium and magnesium. So let's talk, and the good news is that most foods that are high in one are also high in the other. Let's talk about which foods are highest in potassium and magnesium, and I'm going to leave out the ones that are high in sugar, right? So bananas are high in potassium and magnesium, but they're also high in sugar. So if you're diabetic, that's not going to be your best choice. But there's plenty of high potassium and magnesium foods that are not high in sugar. So nuts and seeds, make sure that if you're eating nuts and seeds that they're fresh, not rancid. Best if they're in the shell, if they're organic. And if you're trying to lose weight, they are high in fat. Fat is not bad for you, it's good for you, but you can't just eat as much as you want. That's true. Most of the time, if you're trying to lose weight, you just can't eat as much as you want, right? Some fish like salmon, mackerel, and halibut are high in potassium and magnesium. Dark green leafy vegetables. Avocados. Avocados actually have more potassium than bananas do. Tomatoes and coconut water. And also what I want to mention here is salt, all right, pink salt or good quality sea salt. So the instruction that's given to people, usually by conventional medical practitioners if they have high blood pressure, is avoid salt. But the truth is you actually need salt. It's an essential nutrient. Every single cell in your body has, you know, a sodium channel. So you can't not have any salt. But if you're going to have salt, you have to have good salt. So this is my salt. This is my favorite salt. This is pink Himalayan salt. I love it. And these kind of good quality salts have lots of other minerals in them besides sodium. So you're not just eating sodium. It's a more balanced mineral formula. Okay, so nutrient dense diet is number one. Number two is stress management. And, you know, I love it when people give you advice like, just eliminate your stress or find a way to reduce your stress. Ha ha ha, I think that's hilarious. I have been wholly unsuccessful at doing that. However, you can minimize the damage that stress is doing to your health using various stress management techniques. So the easiest thing to do, which you could do anywhere, anytime, is deep breathing. Because when you take deep breaths, you are activating the relaxation part of your nervous system. That's simple. Deep breath in. And then I blow it out. Do that a few times. I already feel relief just from that first deep breath. Okay, it's so simple. But you can also look up breathing exercises, you know, anywhere. It's so easy to find that stuff. There's a lot of yogic breathing exercises, all kinds of breathing exercises that you can do that will help you. And other types of stress management techniques. There's so many of them. I have 2 videos already on my channel about stress management and also the connection between stress and mineral deficiency. So let's say you're deficient in potassium and magnesium because you're eating a bad diet. It's going to be harder for you to manage stress. So that's a great recipe for high blood pressure, right? Another thing you could do, which is helpful for stress and also for inflammation, chronic pain, is taking Epsom salt baths. So warm, very warm water relaxes your muscles, and Epsom salt is actually magnesium. So it's a way of getting some magnesium into your body. It relaxes you and increases your magnesium levels. Next, number 4, along with stress management, number 3, along with stress management, is using essential oils. There are some specific essential oils that actually reduce your blood pressure and also relax you. So it's not a bad thing to try. The top 3 that I want to mention are ylang ylang, spelled Y-L-A-N-G, Y-L-A-N-G, ylang ylang, lavender, clary sage. Oh, and actually I'm going to mention 4 of them, frankincense. So I love essential oils. I use them a lot. I use this brand, Young Living. I'm not saying this is the only brand that's good, This is my lavender. This is I have my sacred frankincense. You don't have to like the way oils smell for them to help you. You can use them different ways. You can put them on the bottom of your feet. You can put them on your wrists. You can just inhale them. You can put them in a diffuser. Worth a try. You can even put a little in your Epsom salt bath. In fact, I have in my office, I have lavender Epsom salts, really good quality lavender Epsom salts. They might be on my website. I'm not sure, can't remember. Okay, so number 4 is exercise. Exercise actually reduces your blood pressure because it helps your blood vessels to expand and relax, and helps the blood flow through your body more easily. And this is, of course, especially important if you need to lose some weight. So it'll have double benefit. And by the way, losing weight takes some literal pressure off of your heart. It takes pressure off of your blood vessels, like mechanical pressure, right? So when you have excess fat, especially around your middle, it's putting pressure on your organs. And most likely you also have fat on your organs, your internal organs, which will lead to higher blood pressure. It makes, if you have fat on your heart, it makes it harder for the heart to do its job. Okay, so number 5, we're going to talk about some supplements that help with blood pressure. Now, supplements are not a substitute to eating good quality food. And these supplements may not be the only things you need, because if you have metabolic syndrome or you have adrenal fatigue, you might need other things. Okay, so I'm just going to mention the top things that help. All right, so number 1, we already mentioned magnesium and potassium. And it is really difficult to get enough of nutrients from food, especially in the United States, because the soils are depleted. So unless you're growing your own food and you know exactly what you're putting into it and you're making sure that you're replenishing your soil, you may not be able to get enough from food, especially if you have a deficiency to start with. So it's probably a good idea to do some supplementation, especially if you have high blood pressure. Vitamin D3 and vitamin K2 have been shown to reduce blood pressure, especially K2, because it actually removes calcium from the blood, inside the blood vessels, and transports it into your cells. So that's important, because if you have calcium buildup in your blood vessels, it can actually cause hardening or stiffening of the blood vessels. So I use a supplement that has D3 and K2 in it, and it also has some zinc and vitamin C in it. So there's immune support in there as well. If you're interested in having a supplement, a good quality D supplement that has everything in it, I forgot to bring it over here to show you, but I can, you can ask me. I'll have my email on the description, or you can ask me also through my website. Fish oil is also important. It has important components in it for heart health, which have a positive impact on reducing your blood pressure. So I like this one, okay, my favorite company, Standard Process, and this is tuna omega oil, and it's tuna omega-3 oil. And what I like about it is that it's what we call a pro-DHA formula. So fish oil has 2 active components, DHA and EPA, and DHA is the component that actually downregulates the nervous system. It relaxes it, which is good for people that are in a chronic stress response. It helps improve the quality of your sleep. It helps with anxiety. So it's not the only good fish oil in the world, but it's one of my favorites for sure. The next supplement I want to talk about is garlic. So I brought my own garlic over here. I take this. I don't take it for blood pressure. It has a lot of other health benefits, but it is shown to reduce blood pressure and be good for your heart. It's also good for helping your immune system with things like parasites. Parasites hate garlic, and bacteria. So, and fungus yeast. So it's an all around great nutritional supplement. The next one I want to mention is a type of vitamin B formula that relaxes your blood vessels. So some parts of vitamin B tonify your blood vessels and actually make them tighter or constrict them. And some parts of the B complex relax your blood vessels. So we have this formula here. It's called Cataplex G or vitamin G, which there's not really a vitamin G, but what's in here is riboflavin, which is vitamin B2, definitely plays a role in reducing your blood pressure. Niacin, which is vitamin B3, and pyridoxine, which is vitamin B6. So these are the components of the B complex that help to reduce your blood pressure and have a relaxation effect on your nervous system. It also helps a spasmodic small intestine. Just saying. So if you have high blood pressure and intestinal issues, this might be great for you. Okay, and then a couple of herbs that are really good for blood pressure, which I use a lot. Hawthorn. Hawthorn has been used for centuries as a heart support, and I use it a lot with patients just to help to reduce blood pressure while we're fixing all of the underlying issues, but it does improve heart health. And then something called coleus forskolii, also known as forskolin. Coleus is an herb that not only reduces blood pressure, but also helps to reduce fat, helps you to metabolize fat better. So that is fantastic news for people that need to lose some weight and also have high blood pressure. And in men, it can also help to increase testosterone. The other supplement that's been shown to be helpful for high blood pressure is arginine, which is an amino acid. Arginine is a precursor to nitric oxide, which helps to reduce blood pressure. And so a lot of people get some improvement with their blood pressure taking arginine supplements. Now, I don't like to treat symptoms, right? To me, that's symptom management, because you still need to stop smoking, exercise, stress management, clean up your diet, not just take a bunch of supplements and hope for the best, okay? So supplements are not magic pills. They are supplements to a healthy diet. And then number 6, the last thing that I want to mention here, oh wait, just backing up for a minute, going back to supplements, you can also drink hibiscus tea. Hibiscus tea has really great anti-hypertensive or anti-high blood pressure properties. It has many other health benefits. And fennel tea also. So fennel tea has digestive support in there. It has immune support. And it also helps to reduce blood pressure, right? I have some fennel tea here. I'm not saying this is the best brand, but it was the brand that I found in my health food store, and I like it. It's organic. And it also has something called shikimic acid in it, which is great immune support. That's what Tamiflu, the basis of Tamiflu is. So it helps to your body to handle things like spike proteins, which you may or may not be familiar with, but can be a threat to your immune system. And then number 6, the last thing is water. It's just probably the most important one. If you're dehydrated, you're putting yourself at risk for not only high blood pressure, not only kidney damage, but muscle pain, anxiety, insomnia, right? So I can't believe how many people don't drink enough water. It's just ridiculous. You have to drink water. I have a whole video on this channel about water. I can't stress the importance of it. I don't care if you don't like it, you still need to drink it. You know, I teach people that that they have to do things even if they don't want to, if they want to be healthy, right? So drinking really good quality water is very important, especially if you're drinking caffeine and alcohol, which are diuretics and pull fluid out of your body. So that's it for now. I hope this was helpful. Please don't forget to like. If you like it, it helps other people find it. Share it with anybody you know that's struggling with high blood pressure. And if you haven't had a chance to subscribe, please don't forget to hit the subscribe button. And I will see you all in the very near future with more important health information.